I welcome you all for today's podcast on understanding Parkinson's disease and the advanced treatment options such as deep brain stimulation surgery. Today, we have a thrilling story about Parkinson's disease by our very own patient, Mr. Mohammed Al Zaabi, who is our special guest for today. And I also have our esteemed neurosurgeon, Dr. Tanmoy Maiti, who has performed all the deep brain stimulation surgeries at Cleveland Clinic Abu Dhabi and offering advanced treatment options for our Parkinson's disease patients. So, before we dive into the story of Mr. Al Zaabi, I want to touch base about what is Parkinson's disease in a very simple language. Parkinson's disease is a brain condition, is a neurological condition where there's a loss of dopamine producing cells. There are other non motor symptoms such as constipation, low mood symptoms, sleep problems, pain, and many other concerns that we don't see. There are medications which help with Parkinson's disease. More than medications, the lifestyle changes are very important, such as exercise and staying active. Medication works very well in the initial phase of Parkinson's, but as time passes by, we need advanced treatment options.
Exactly, Dr. Shivam. I completely agree that there might be multiple symptoms I have seen that patients do not know that they are correlated. And once they reach a movement disorder specialist, neurologist, and when they connect the dots, they are sometimes surprised that, oh, I didn't know that all are part of the spectrum. And sometimes they come to other doctors for, say, back pain or some other urine problem or some sleep problem. And ultimately, we see that all are connected. And as Dr. Shiva mentioned, this is also true that though the neurologist is the leading doctor in the team, there are role of other physicians and the other technical people who are in the team who are also working as a team to improve the quality of life, such as a neurosurgeon or a gastrosurgeon or a physical therapist or occupational therapist, speech therapist. All of them are important in the care of a patient. And every patient is very different. Their symptoms are very different, their journey is very different, and it's very important we understand and address the specific concern in those patients. When it comes to surgery, it's always the last option. Not really last option, it's one of the options. So what we see, the medication is always the first option, the main option. And then based on every individual patient, we see that between year number 4 and year number 9, we see that some of these patients, they are not being good controlled with medications only. That is when we need to think about other advanced treatment options. So advanced treatment options are many. So that's why you need to come to a team who is specialized in all of this. It's not one option. So we are here in Cleveland Clinic Abu Dhabi where we have all options, all advanced treatment options. So we can decide based on one single patient's need which treatment option is best for that particular patient and that particular stage of Parkinson's disease. So each point is important. You might be fit for one advanced treatment options in the beginning, but you might not be fit after a few years. So we have to switch this. So one medication or one treatment option does not fit all. We need to change, and that's why we need the expertise of a movement disorder neurologist and the whole team like Dr. Shivam, who leads our team. He specializes in all these options, so we know that when to do what for all these patients.
Thank you, Dr. Tanmoy. Now let's come to our special guest, Mr. Mohammed Al Zaabi. We are very pleased and excited to hear your story. You are a Parkinson's warrior, a fighter, and you are helping so many people by sharing your story today, Mr. Al Zaabi. So, a warm welcome to you.
Thank you. صباح الخير. محمد علي الزعابي. جاني المرض هذا في سنة 2015. الباركنسون أو اللي يسمى الرعاش. فضرب عندي في اليد اليمنى. فظليت أنا يعني أعاني من هذا فترة طويلة حتى ذهبت إلى المستشفيات رحت أمريكا ورحت أوروبا ورحت آسيا وهذا العلاج يعني العلاج كله متساوي نفس الشيء يعني أدوية عادية فلما جيت هنا الإمارات رجعت مرة ثانية الإمارات علموني بأن في مستشفى في كليفلاند أبو ظبي. الوقت كان هو حين بدأ يعالج الناس مرضى من هذا الشيء. فبديت معاهم العلاج مع الدكتور شيفان مع الدكتور تيموي، وبديت وياهم العلاج لفترة حوالي يمكن 3 سنوات. بديت وياهم العلاج من بعد ما اكتشفت 3 سنوات. فأخيرا قرروا بأن لا نستخدم اللي هي ديب برين سيرجري. والحمد لله يعني بعد العلاج وياهم حسيت في تحسن. طبعا كان سابقا قبل ما أسوي العملية كان هناك في بعض الأعراض تطلع عندي، الترمر الهاند، رشوة اليد، رشوة الرجل، فكنت ما أقدر أعمل أي حركة. ليش؟ لأنه كان هو هذا منزعج من أنا المرضى. حتى تروح عند الجماعة، تروح تشوف جماعتك ما تقدر، لأن الترمر أكثر من اللازم في اليد اليمنى واليسرى. بعدين انتقل وبدأ الدكتور شيفان نصحني بأن أقوم بعملية في البرين حتى أتلاشى هذا الشيء، أو إذا استمرينا فيه، لأن هذا له عمر معين لازم تعمله قبل ما توصل عمرك 70 سنة لازم تعمل العملية هذه، لأن لازم يكون أقل، يكون عندك إمكانية تقدر تعيش فيها بعد فترة. والحمد لله عملت العملية مع الدكتور، وحسيت بأن في بعد العملية في تحسن وايد طفيف، يعني حوالي 95%. حسن 95% يعني تعدلت أوضاعي. رحت صار عندي النوم، أنام كويس، أصحى كويس، يعني ما صار عندي آلام في العضلات، وفي أشياء وايد. ليش؟ لأن بسبب كان المرض مزعجني وايد يعني. والحمد لله بعد العملية هذه بنجاح أقدر أعيش، أسوق سيارتي، أطلع رحلات، أروح أسافر أرجع، وهذا كله بفضل الله، ثم بفضل الدكاترة الموجودين في مركز الأعصاب في مستشفى كليفلاند. الحمد لله. فصرت أعاود من بين فترة وفترة أتعالج عندهم، يعملوا أجسمنت حق الجهاز اللي عندي. ولكن الحمد لله يعني أفضل من ما شيء، يعني أفضل من أشياء كثير يعني. بس ليش؟ لأن نصحوني لو ظليت قاعد بدون أي عملية فبيظل المرض يتطور لين حتى به. فأنا أنصح كل واحد عنده هذا المرض يبادر بيشوف الدكتور شيفان أو الدكتور تيموي، على أساس أن يعملون سيرجري أو يشوفون إيش عنده المشكلة، حتى أن يتلاشى هذا المرض بأسرع وقت ممكن. والحمد لله البقية عند الله سبحانه وتعالى إذا كان أوكي. بس لازم هو يكون هو متقبل العملية، لأن هذا العملية كبيرة، يتقبلها، يقول نعم أنا I have to do it. I have to do the surgery. That time, yes, he can do it. Then he can exceed it. مثل ما أنا الحين والحمد لله عايش بأمور طيبة في بيتي، في سيارتي، وأروح وأجي في الدوام، يعني ما صار يأثر علي في الحياة. أعمل رياضة، أعمل أشياء وايدة، الحمد لله رب العالمين. أنا مرتاح من العملية، وأنصح جميع المرضى اللي عندهم هذا المرض يبادرون في الإدارة بالعمليات الطيبة، لأن الأدوية تنتهي، لها مفعول بسيط جدا، تنتهي الأدوية. فإذا أخذوا الأدوية مرة مرتين ثلاث ما يظل عندهم، لابد أن يعمل علاج على طول العمر. هذا اللي صار عندي أنا بالنسبة لللايف مالي من أول ما بدينا وياهم من 2015 جاني المرض حتى الحين، هذا هو اللي صار. شكرا.
Thank you, Mr. Al Zaabi. I could understand a lot of things. But Len, briefly, if you can.
First introduced himself. He's a Parkinson patient. Everything started back in 2015. He had been to US, Europe, Asia, different doctors, different hospitals. No one was.
He went to my mentor, Dr. Elskog at Mayo Clinic. Yeah.
He said, yeah, US. And he was just offered medications, basically. And then he learned about Cleveland Clinic Abu Dhabi and that we have advanced treatment options. So he came here. I think he said that he was already, like, he was diagnosed for 3 years prior before he started seeing you doctors here. And you advised him to go for DBS surgery because medications can help so much, and it's a progressive disease. Things will only keep progressing and getting worse, basically. Medications have their own limitations, and that it's best to do it before he turns 70. So he went ahead and he did it, and he by grace of God, he has gotten much better, and thanks to the great NI doctors here in CCAD. And he's saying that pain is better, sleep is better, the quality of life overall is much better. He's able to go out, have fun, travel, drive his car. So things have improved. Before that, he would be embarrassed and things would be very inconvenient in social settings and whatnot. So all this is now much, much better for him. And he advises people whoever has Parkinson to come see you and to seriously consider DBS and put in their mind that they want to do it and that it will help them, and go ahead.
Excellent. That was fascinating to hear, Mr. Al Zaabi. It was really, really great to hear your story and how you felt about it. Now, I will come and I will ask Dr. Shivam one question, that as you mentioned, there are multiple advanced treatment options. In your practice, or based on your experience, when you decide between which advanced treatment is good for the patient at which stage, if you can tell our audience about that.
Sure. So Parkinson's disease is a very individualized, customized treatment. Every person is different from one another. One person is not exactly same as the other one. So it's a very good partnership between the patient and the doctor, where we talk to each other, we understand the symptoms, we see how we can manage the symptoms, lifestyle measures, diet, exercise, medications, they play a big role in controlling the symptom of Parkinson's. Unfortunately, Parkinson's disease is a condition which progresses with time. We don't have a cure for Parkinson's yet. And with time, after 5 to 6 years or 7 years, we see that patient starts having fluctuations. Like the medicine is working for some duration and it stops working after a short duration. The medicine is only working, say, maybe 2 hours or 3 hours or maybe 4 hours. And sometimes the medicine is not effective at all. At that point, that's a point when we start thinking about what's next. What are the other options we can use to help improve the quality of life? When we look at the advanced treatment options, number one is, as we are discussing, about deep brain stimulation surgery. This is a surgery where we are putting in electrodes in the brain to stimulate an area which helps to give the response similar to the medications and controlling the tremor, Parkinson's symptoms much better. There are other options such as pump therapies, infusion pump therapies. There's a medicine, we can give the same levodopa medicine, dopamine medication through the skin with a new treatment called subcutaneous phospholevodopa, or a tube in the stomach where we give the medication through a pump, which is called duodopa. So these are some new advanced other options where we can give the medications throughout the day, but the patients have to carry a pump with them all the time. So for me, the patient's preference is the priority. If the patients feel that, doctor, I am not comfortable with the brain surgery, we don't offer DBS surgery. But if the patients tell me that, doctor, I want independence, I don't want anything with me as a pump when I'm doing my exercise, when I'm going to my work, I don't want to keep a pump in my pocket or want to hold on to something to continue to control my symptoms, in that situation, deep brain stimulation is a very good option.
Excellent. So, Mr. Al Zaabi, I will come back to you. I would like to know at what moment, because you have been through everywhere, you have been to many doctors, and at what point you thought, okay, this is the time I think I should go for the deep brain stimulation surgery?
Yes, thank you for your question. طبعا بدأت التفكير أن أعمل عملية بعد ما حاولت أكثر من مرة أو مرتين برا في بعض المستشفيات خارج الدولة. ما النتيجة صارت لا واحدة، لابد من عمل سيرجري للدماغ. وأخذت قريت عنها أكثر من مرة وطلعت عليها حتى على الدكاترة أنا شفتهم، رحت لهم شفت السي في مالهم، هل عملوا عمليات، شو المرض هذا، كيف العمليات، كيف تتم، أشياء وايدة. بعد هذا احتجت لازم إني أعمل العملية هاي، لأن المرض هذا تم بعد كل فترة ياخذ منه وقت، يعني في الترمر، اليد، الرجل، أشياء وايدة. فقلت لابد إني أعمل العملية، خلاص اتخذت القرار بأني أنا أعمل. حتى كانت العملية يعني إذا كانت خطرة أو شيء فلا بد إن المريض يحط له برسنتج بأنه في يتجاوز هذا ويتوكل على الله ويعمل العملية وإن شاء الله يكون كل شيء تمام إن شاء الله.
He's saying that basically after having been to a couple of hospitals abroad, everyone seemed to reach the same agreement or the same decision that it's best to go for DBS surgery for him. So he read about the resumes and the medical backgrounds of the doctors. He thought about it. He consulted people he knew, and he decided on going for it. He knows that it's something major, but like he just decided to go ahead with the surgery.
No, this is very well said, Mr. Al Zaabi,
Very
and
nice.
this is a very important decision in anyone's in a life of a Parkinson's patient. I think the making a decision of what I'm doing about my future and taking a stand for it is very important, and I congratulate you on doing that. I see many patients in my clinic, and this is a common question that is asked is, doctor, should I go for DBS now or should I do it later on? And you have answered the question very correctly. When the patient is ready, when the patient is comfortable, has confidence in the team that he is meeting at the hospital, that's the time they should go for the DBS surgery. Mr. Al Zaabi, you mentioned that you are now driving after controlling your symptoms with the DBS device. I want to know what other things that you are able to do now which you were not able to do before the surgery.
Before I cannot do my sport, which is my favorite sport, which is running. Okay, because my life I am running about 5 or 6 kilo
Very good.
daily. Now when I done before the operation, yes, I cannot do it. That now after I done my operation CB, it's okay. I can get it in my life, doing everything. And just only doing my hobby. Any hobby I have it, I do it now because it's okay for my life. And I will mention something, small thing. This DB brain surgery. Not when you go. Yes, it was a shock. Okay, I say he will go to inside brain surgery, brain inside it. Of course, everybody they will say, "Oh, brain." He will touch my brain. No, even that they touch your brain, but still there is a very good doctor. They are worried about you and they are take care of you for this surgery.
Very well said. Very well said.
Thank you so
Dr.
much.
Tanmoy,
Thank you
can
so-
you explain very briefly what do you do
Yes.
in the surgery?
That's a very important question. So I will tell this surgery has 3 parts. First is to select the right patient. Second is to do the surgery in a very precise way. Third is to do the programming. During the surgery, we do absolute precise way, and it needs a very technical advanced techniques. So we do a very particular type of MRI of brain where we try to see this very small structure of the brain very clearly. Next, during the surgery, we check signals from each cell of the brain on our path, and then we wake up the patient to make sure that we get very good control of the symptoms and we also don't have any side effects. And then we also do a scan during the surgery to make sure that we are exactly where we intend to be. So we do all these things, brain physiology, brain imaging and intra-op test to make sure that we get the best result out of it. So almost all the time when we are completing the surgery, we know for sure that we are in the right spot. This is possible because of the technological advancement, and we thank Cleveland Clinic Abu Dhabi to bring all the technical advancement under one umbrella where we can do this surgery very precisely and at the same time very safely.
So, as Dr. Tanmoy mentioned about the surgery, the third most important step is programming. After the surgery is done, the patient needs to come to the clinic where we do the fine tuning of the programming of the chip in the brain. And we use this using this device which is called the programmer. This connects directly to the DBS device, which is implanted under the chest, so nothing is visible. It connects remotely, and then we can go up and down on the stimulation, make changes in the settings based on the patient's symptoms. So after the surgery, when Mr. Al Zaabi came for the first time, I started the DBS device, I made some changes, his symptoms got much better, but after a few days, he noticed a tremor was coming back. We had a second programming session where I adjusted the settings, and then we can fine tune. And finally, after 2 or 3 settings, we were able to control his symptoms very well. This device can help to control the symptoms in the long term without touching the brain, just using the programmer in the long run. To conclude this session, I would like to highlight that Cleveland Clinic Abu Dhabi has completed more than 100 DBS implants, and this is not possible without the meticulous support of all our team members, our movement disorders team, neurosurgeons, psychologists, and of course, our dear patients who are the hero of our Parkinson's program. I really thank Mr. Mohammed Al Zaabi to share his story candidly and share his perspective about Parkinson's disease. I really hope that this will help to raise awareness about Parkinson's, bust away the myths of Parkinson's disease, and help thousands and thousands of people who are struggling with this condition. Thank you, Dr. Tanmoy Maiti, for joining us.
Thank you so much.